Good afternoon, Mr. Parrish. So, what a big event is going on today?
Right now, we've been approved for our Phase 2 plan. That Phase 2 plan consists of us opening Santa Fe CDC, First Division CDC, Indian Head CDC, School Age, and Middle School and Teen. And we're going to realign some of our medical personnel over to our SFAC facility, formerly known as our hourly care facility. We're going to provide full daycare there for some of our medical personnel. And those that we can accommodate at that facility, we're going to accommodate them throughout our other facilities that are going to be reopening. Now, it is open with some restrictions. Right now, we have roughly about 180 or possibly more spaces for our CDCs that we're going to reopen to try to provide some services for our single and our dual active duty households. And our Parent Central Services team are making contact with all of those patrons as we speak now, trying to get everyone back into care after the holiday. We open up on the 22nd, but we may not have a huge crowd, but we're definitely going to have a lot of folks on the 26th when we return.
You mentioned that this program or this reopening phase is actually for single parent soldiers as well as dual military parent soldiers. With that, you also said that you have probably about 180 slots. That being said, number one, what is the determining factor? How is it determined who gets selected for this process? And secondly, what do you do if you receive more than 180 applicants?
Well, if we get more than 180 people in our CDCs, we do have a reopening plan that has to be approved by the senior command. And as I can tell you right now, we understand there's a huge demand. We're not going to, be able to accommodate maybe all, but we're going to do our best to try to accommodate as many people as we can because, we do understand we have to reopen. We have a lot of drill sergeants. We have a lot of medical personnel. We have a lot of personnel here at Fort Benning, period, who have to get back to the mission. And we do have a mission here at Fort Benning, so we want to try to accommodate as many as we can within reason because, we still have to protect the team. We have to protect the children, anyone that could possibly come in contact with anyone. And the last thing that we want is anybody to come in contact with one of our child and youth services personnel and, they possibly contract the virus and then, we have an outbreak and, we want to limit the risks as much as we can and we want to be smart about how we're reopening and providing services. So, this is our first phase of reopening and opening up the aperture to the community. And we definitely want to make sure we identify our military active duty population, starting with our single, our medical personnel, our dual households, those who are identified by the units. So right now what we're doing is we're working with all the units. They've sent us some spreadsheets and identified, who's mission essential, who needs childcare right now. And so that's worked really good. We've created some touch points who have provided us really good information. We've reached back and said, hey, we've reached out to, this household. This is what has been communicated to us, and this is what we've conveyed back to them. And we've sent back some of the units, some of the spreadsheets so far to show them, hey, this is a snapshot of what it looks like. And this is what we've filled so far based on the spreadsheet you guys have sent us with the information identifying the soldiers who need childcare right now.
With the soldiers that have been identified, what is the process to enroll their child into the Child Youth Services Program? Is there any website they have to go to? What does the registration process look like?
Yes, sir. So the registration process starts at our Parent Central Services office. Miss Daphne Montgomery, who is our Parent Central Services Director, her and her team are reaching out to everybody. If there is a new household who's never been in childcare with us, they are being referred to militarychildcare.com. When they go there, they'll build a household profile. They'll request for child care. I would recommend, if you're requesting for child care, request for all of our facilities. So that way you can be on all of the lists, and we can have a team member from the office give you a phone call and say, hey, we have a space here. Are you guys prepared to take it? Because it's a process, and that process does start with things like we have to verify income, we have to verify eligibility. We do require that, the soldiers and families do have some type of mission essential or key essential memo from their command. All of those things like that are part of the registration process, where we have to identify every aspect of the household.
What safety measures are teachers taking to safeguard children as well as themselves throughout this COVID-19 pandemic in this type of environment?
Right, that's a great question. And when the virus first was made known publicly, we started stocking up on cleaning supplies, Lysol, hand sanitizers. We've ordered hand washing machines that will be centrally located outside of our facilities. Coming into the facility, all temperatures will be checked. So we have thermometers, we have the touchless thermometers where you can scan the forehead of any individual coming in to read their temperatures. You have to clean your hands in and out. There's sanitation machines located outside of each classroom, inside and out. Also, we're also implementing curbside drop off. So we're going to have team members come out. They're going to check everyone's temperature to ensure that, no one's sick, and, try to limit the contact. So that has worked really well. That's something that has been implemented enterprise-wide within Child and Youth Services, and has worked really well to reduce contact and spread of any diseases or germs like that. So those are some of the things that we've implemented so far. We also have a cleaning team that cleans every day. We have custodial staff on board who clean every day, all day as well. We also have the support of the medical team who will partner with us and ensure that the facility is clean from top to bottom down to ensure that, we've limited as best as we can the pose of any contact or pose of any disease, or limit the spread as best as we can. So there's a lot of cleaning procedures that have been put into place, a lot of steps even coming into the facility to access children, access staff. Also, one of the great things we put up is those protective shields at the front desk as well. So that limits a lot of contact as well.
What other safety measures are the staff taking to help prevent the spread of COVID-19?
So we've started stand down trainings. We started about 2 weeks ago. We've gotten the medical team, fire safety. We've partnered with our brethren program, ACS, and we've worked to educate the staff on, like, hey, this is what it's going to look like in your environment. Here are some of the new standards that have been put into place as far as cleaning toys, how we receive children, how we serve food, how you change diapers, wearing gloves. Like I said, we've stocked up on a lot of supplies to ensure that the staff have what they need to ensure the environments are cleaned properly. We've ramped up, just the clean of the facility, period. So that's been very helpful. Also, too, staff will have ongoing training at all times, just as a reminder, reinforcing, like, hey, this thing is very serious. You guys have to clean. We've also implemented more site visits from the team to ensure that everyone is following policy and procedures. So it's been well received, and the staff feel as safe as they can be in preparation for receiving children and families. But I think, there's still going to be that, concern of, how can we do this better? And I think we're improving every day. We're looking at best practices from other garrisons. We have a conference call every week with higher headquarters. We also do a conference call every day, the MWR team. And we're always looking at new inventive ways or creative ways of how we can do things better.
The Center for Disease Control and Prevention recommends that children under 2 years of age shouldn't wear face masks. How does that work in this environment?
That's a great question. And I would say as a parent, someone who uses the services as well, is that education is key. We've bought educational books. Teachers have lesson plans. A lot of the parents have really gotten involved, and it's been really helpful. Um, Now, although children under the age of 2 is not a requirement, we would recommend that parents, you do talk to the children, educate them on why wearing a mask is important. Um, because we're going to try to educate the children as well about the importance of like wearing masks and limiting contact and different things like that, the social distancing. Also, too, we've had to implement things like we can only have so many ratio of children in the classroom at one time. Although we have to maintain ratios, there can only be so many children in the classroom at one time. So, there's a lot of protective measures that have been put into place to try to limit the contact and spread of, germs and diseases, in the virus, period.
So you have children, 4 years old and all that above, who have been in self isolation and quarantine with their parents for a number of weeks, months at that time. And here we are opening back up, and they're about to see their friends for the first time in a long while, as well as some of their favorite teachers. Um, how are teachers going to manage that in this type of environment with social distancing, wearing masks? How do you manage that when a child just wants to play?
Oh, we have some of the best teachers out here ever. They're very warm. They receive the children well. They're very loving and caring. They're just really great people, and that's what you look for when you have teachers or you're looking to hire on teachers. They have to be people, and they have to love children and love what they do. I can tell you these teachers have worked really hard. They've attended a lot of trainings. They've been doing a lot of planning. There's been a lot ongoing that they've been doing that I think everyone will be happy with coming back into care. The children will be really excited. Some of the teachers I know are on social media, so some of the parents and everybody probably have reached out. Hey, I need help with this. How do you guys do this? And I'm not used to having the kids at home 24/7. I need some help. I need some guidance. So we've been there. We've been, right there in the forefront of helping families, and I think coming back, it should be a pretty smooth transition, even though we understand it's going to be a transition, not just for the children, but also for the parents. But my recommendation would just be to start talking to the kids now and getting them excited that, hey, look, childcare is reopening, and you're going to be seeing, Miss Felicia, you're going to be seeing Miss Anna, or you're going to be seeing Miss Sam, who's one of our great directors, or you're going to be seeing Mr. Cody, who's over at the youth center, or Miss Tawana, who's the school age center director. Just start getting them excited about going to see all those great people that they've been around, and some of those people who are like second nature parents, in the community, like helping out. So I'm excited that we're reopening, but at the same time too, I have to be very realistic and understand that, there are safety and concerns out here that, a lot of our, employees and parents and everybody will have questions and want to understand like what we're doing and how we're doing it. So, we'll try to be good stewards as best as we can with ensuring the information that we put out and that we give out is as accurate as possible and as supporting as possible.
What would you tell parents that aren't single soldiers and are not dual military families that don't meet those requirements you stated earlier, but still are seeking assistance from child youth services? What would you say to them during this time?
I would tell everybody just to be patient. We're reopening. The command, senior leaders, everyone is preparing to reopen. Just be patient with us. Try to be as understanding as possible. If there is any concern and anyone needs support or need help or their senior leadership has questions, they can always reach out to me by email, by phone. I think about at this point, just about everybody has my telephone number and has my email. I'll help out as best as I can and try to, make it a smooth handoff as best as we can. If you're a new family and you've never been on base or had childcare on the installation, feel free to contact our Parent Central Service Office at 706 545 2079. The team has a lot of great information, a lot of great feedback they can provide to you. And, we're really great listeners. We're very supportive. We try to be there for any and all as best as we can. Um, I would just say, just be patient with us. We're working on reopening plans. Things may not be as moving as fast as the states as they're reopening, rapidly, but we're working towards reopening. And as soon as we can get approval, we'll reopen the aperture to all, and we'll be able to call everyone back to childcare. And oh, more importantly, too, I want everybody to understand too that if you were previously enrolled in our program before the COVID, you will have your same space coming back. The team is working and getting in contact with everybody and identifying, hey, who's PCSing, who's not coming back, who's going to be out for the summer, are you guys going to be returning for the next school year? So the team is working on those things like that. So just be patient with the team, be patient with the process, and we'll have updates and we'll provide more as senior leadership approves things.
Well, Mr. Parrish, thank you so much for your time. I know that these questions were actually on the minds and hearts of parents all in and around all of Fort Benning. So thank you so much, and I hope and look forward to more updates from you. Thank you so much.